It opened in Sacramento about a week ago, and we sent Jody Moreno down there to check it out. And if you haven't seen it, it's an amazing look at the human form using real human specimens, showcasing what the human body can do.
Really cool. Another way to know what your body can do is through chiropractic medicine. For some, though, the benefits of chiropractic treatment may still be a mystery. So here to clear things up is Dr. Robert Hulbert from Sacramento Spine and Disc and New Life Laser. Doctor, nice to see you.
Thank you.
People, you think, still have misconceptions about chiropractic care?
Yes, they do. And I think it comes from the lack of knowledge on the anatomy. And if we knew and understand the anatomy, how it works, then it clears a lot of things up.
What are some things that people out there need to know about?
Well, let's start with the anatomy. A spine from behind should be straight, and the pelvis should be level, the shoulders should be level, and the head should be on straight. The reason why we have that is so when gravity pushes down onto us, it pushes equally into the ground. A spine from the side should have curves in it, a curve in the low back, curve in the mid back, curve in the neck. The reason why we have those curves is so when we walk, we actually spring when we walk. It distributes the load. Now, if those bones get misaligned, they begin to irritate the delicate nerves in the nervous system.
So what happens if you get a pinched nerve?
Well, it depends on where the location of the pinched nerve is. For example, if somebody was misaligned up on this top area here, then it would irritate the nerves here that go around the head, and then the symptom would be headache.
Wow.
Oh.
Now, if somebody was misaligned a little lower, say in the mid-back, they might have mid-back pain and then have an ulcer and not know the two are related.
Wow.
That's crazy. It's very complex.
It is, but in simple terms, we can just, if we know the anatomy, know the brain controls these vital organs, and if the spine is misaligned, then we can draw the connection. Further, if the spine is misaligned, the muscles must go into spasm. And if you have spastic muscles, you may be tight, and knowing that the bones are misaligned, and you may take a muscle relaxer or something that will calm the pain, but not necessarily straighten the problem out.
Fix it. So if you're having any kind of pain, how do you know it's a good time to see a chiropractor? Should there be certain red flags?
Well, yes, and if you see a loved one or yourself or is a little bent, a little stooped over, mechanically imbalanced somehow, I recommend a standing set of x-rays. And then so most chiropractors do a valuable exam. But if you do the x-rays, then you can actually see your spine, compare your spine with what normal looks like, and then go from there.
Well, you were saying that if you're having headaches, it could have something to do with the alignment of your spine. Most people, I would imagine, would go see their regular doctor for that, not imagining that it has anything to do with the spine. Do doctors refer patients to chiropractic doctors?
Absolutely. It's getting more and more common. Obviously, the anatomy is irrefutable. If the bones are misaligned, then the chemicals will not realign those bones. And that's where the value of chiropractic comes in. What my expertise is to look at the anatomy and go to work on correcting those, very similarly to putting braces on your teeth.
Now, what happens when someone makes an appointment, comes into your office? What do you do?
Very good. We start off with the history and see if they've been in any impacts or traumas. Most people have, playing football or water skiing or a host of other traumas when they're a little kid, getting knocked off balance. Then we do a postural exam, checking to see if they're aligned or if they're off balance, seeing if their weight has been misdirected on one side or another. And then we take a set of standing x-rays from the neck down to the pelvis. And that way we can see front and side.
I bet you hear a lot of great stories after you've treated patients, and I bet a lot of people are grateful. I have a cousin who lived with chronic pain almost her entire life, and then she got it taken care of through chiropractic, and she said it was like a weight lifted off her shoulders.
Wow. Yeah, isn't that amazing? Once the body is in balance, there is that weight that is distributed equally. But if the body is off balance, you've seen people walking slow and off balance, and those people have the weight of the world on their shoulders, so to speak.
And in terms of how immediate the results can be, Dr. Hulbert, I guess it depends how long they've been suffering with the problem, right?
That's right. If somebody fell out of the tree when they were 5 and they came in and they got realigned, that's a very short treatment period. But if they fell out of the tree when they were 5 and then they come in when they're 25 or 35 or 45, there are different treatment programs and protocols for those people.
Do you find that happening often?
Oh,
where people
absolutely.
have lived with this for a long time?
Absolutely, yes. And children, those of you that have had children know that they fall, and we were like that at one time. We fall off the tree and off the fence and off the horse, and then we sort of live with those infirmities.
So now is a great time to come in?
Absolutely. The sooner the better. If the bones get misaligned, then they'll be mechanically challenged and arthritis forms. And if you catch that early, then the arthritis is at bay.
Okay, and we have all the information right there on the screen for Sacramento Spine and Disc. You can make an appointment today. Just call Dr. Hulbert. Thank you so much,
Thank you,
sir.
Doctor.
This reminds us of that game, Operation.
Yeah, exactly.
We weren't very good at it, or at least I wasn't.
He is, thank you.
I always say yes, he is. I'm not.
Thank you, Doctor.
Thank you.
Appreciate that.